There's plenty of lies and misinformation in coronavirus, so Truth Lies Shenanigans brings you the truth. Stories directly from the people that lived it, frontline workers and survivors. This is the Covid Chronicles. Hey, today we have joining us again Dr. Marjorie Simpson. She's a board certified geriatric nurse practitioner with her PhD from the University of Maryland, and she works at several nursing homes in Maryland. She actually joined the show in our first season, episode 38. You can watch that on YouTube, Facebook. Check the link in our description. Dr. Simpson, welcome back to the show.
Thank you so much for having me.
So my first question, how are you and your family, Lisa and Liam, holding up?
We are doing fantastic. We're all triple vaccinated at this point. We're all healthy and enjoying that snowstorm in Maryland.
Yeah.
Snow is falling. All right, so now the last time you were here on the show, there was no Delta variant, no Omicron. And although your nursing homes were doing better than most, you definitely painted a tragic image of what you were seeing in the nursing homes with difficulties getting basic PPE, personal protective equipment, COVID testing, and people dying before their time. So what are you seeing now?
Now that we have the vaccine, I'm seeing a very different picture. I currently have a COVID outbreak in one of my nursing homes. I was there making rounds this morning. I have 9 patients who have COVID, and they're all vaccinated except one, and they're all doing really, really well. So I think that now having access to the vaccine, as well as having better access to PPE, has really made a difference in the nursing homes. There has been a bad outbreak with the staff in that facility, as in many other facilities. And when a staff member tests positive, they have to go into quarantine and they can't work. So we're seeing staffing shortages in nursing homes, as well as the hospital. I also work in an acute care community hospital as well. And, doctors, nurses, people who have to be out of work because they've tested positive.
So are you seeing fewer people dying early now?
I think that we're still seeing um, what we're seeing is we're seeing unvaccinated people dying.
Mm.
Okay. Okay.
I on the acute care side, all of the seriously ill COVID patients that I have seen, that I have treated, who have passed away, were unvaccinated.
Mm.
People who are maybe they've had 1 or 2 vaccines, they're not triple vaccinated, but they've had something, and they have some underlying health problems like lung disease or heart disease. They're a little more seriously ill. The patients who are triple vaccinated are doing very well. We're not seeing them because they're not coming into the hospital.
Now, when you reached out to me, there was something specific that you wanted to discuss. What was that?
I do. And, one of the things that I do on the acute care side is I work as a palliative care nurse practitioner. And in palliative care, it's healthcare services that are aimed at optimizing quality of life and mitigating suffering in people with serious and complex illnesses. And I also help people with advanced directives and with their goals of care. One of the things that we see when someone comes into the emergency room with COVID in respiratory distress, they're in crisis. They may have some delirium. They may be confused. They may need to be intubated very, very quickly. We don't know sometimes if they have a next of kin, if they have a healthcare agent, if they have an advance directive. So very quickly, we're trying to help people determine, who is that person that you can trust to help you make decisions if we have to intubate you and you can't speak for yourself.
Okay. Now, Robbie, you had a specific question along these lines.
Well, it's yeah, it's more of a personal kind of thing. Just because I live with my elderly father, or actually he lives with me, and I do have power of attorney, and we have a living will in place, so that if ever we're in a situation where those tough decisions need to be made, I'm enabled. I'm empowered to make those decisions. Um, but from a financial perspective, I know that what we also did
Mm,
was when I became the power of attorney, because we have a good family dynamic, my father opted to include me as far as any ownerships or accounts. So my name is on the house, my name is on the car, my name is on his bank accounts and his investments. So that way, if anything were to happen, it's simply a matter of presenting a death certificate and not a matter of having to go through that rigmarole and acquiring all the accounts. Just administrative, and I mean, it reduces administrative costs tremendously down the road. Now, I live in Canada, and I'm just wondering if that's also similar in the States.
In the United States, you can develop a medical power of attorney, and that's someone who makes medical decisions for you. You can also have a financial power of attorney, and that's someone who can access your bank accounts, someone who can help you pay bills, someone that can um, um, take money out of the bank for you, open a bank account, close a bank account, and handle the financial side. So there's two different types of power of attorneys. Sometimes people have one and they think they have both, but they just have one of the other. And it's really important for someone like yourself who's taking care of a parent who's older to have all of those things in place. It's easy to access those forms. There is a website called caringinfo.org, and there's also advanceddirective.com where you can go on and click on your state and download for free the advanced directive forms and the power of attorney forms that you need, print them out and complete them. You do not need an attorney to help you do that.
For our audience members, I just posted those links in the Facebook chat.
The only thing that you need when you're establishing your advance directive and your power of attorney is you'll sign the form after you fill it out, and you need two witnesses to witness your signature.
Mm.
And the person who witnesses your signature cannot be somebody who is listed in that form. So if you make your sister your power of attorney, she can't be a witness of your signature. Grab a neighbor, grab two friends, have an advance directive party where everybody, fills out their advance directive together. And then once you have it, make a copy of it. Give a copy to the people that you have listed as your medical power of attorney. Give a copy to your doctor.
Yeah.
There are websites where you can register your advance directive online. Some of them are free. Some of them do have, a charge, but it can be accessed in any state that you go to, which might be an option for someone who does a lot of traveling, particularly for work or something.
Yeah. Yeah. My grandmother, when she was the end of her days, she was struggling with pneumonia. She was intubated. She had trouble talking, and she had a power of attorney, a medical power of attorney, who helped her make decisions, medical decisions for her, as to whether or not she should get certain tests, whether or not she should have certain medications, certain procedures done. So those were very important to her health care. So Lizzie, did you have any questions?
No, I just want to first to thank, Dr. Simpson for giving us that information. And to say to Rob, like, I think in the States, it's not necessarily what's available, it's that a lot of citizens, a lot of people that live here don't have the information,
Mm,
or they don't want to talk about,
dying,
their parents
death.
dying, medical history, things like that. Both of my parents have passed on, and my mom died, in 2013 and didn't have a will. My sister, Jacqueline Robinson was her power of attorney, but we didn't know where a lot of her insurance papers were, or she didn't specify, you know, specifics about her care or anything like that. So thank you, Dr. Simpson, for providing that information because we've seen with, COVID over the past 2.5 years, you know, um, a lot of people dying abruptly and not having a plan, not knowing
Mhm.
about insurance, not knowing about even before they die what type of care, your loved one wants. And then you see a whole bunch of GoFundMe's at the end, once the end is near, people trying to catch up on that. So I appreciate the information, Dr. Simpson. My question to you is, and this is kind of like a non academic question, just a personal question. How tired are you and your staff? Because we're on year two.
Yeah. I think the staff is absolutely devastated. I think that they are exhausted. It is tremendously sad to come into
Yeah.
work, and we are seeing entire families in the hospital at the same time. Husband and wife in rooms right next to each other on ventilators, and their
Mm.
adult children are making the decision to pull that plug and take them off of life support and having to deal with a double funeral for both parents.
Wow.
And that is just it's devastating to family members. It's devastating to the staff, especially when we're seeing 70 to 75% of the people that are hospitalized because of COVID are unvaccinated when that vaccine is
So it's preventable.
available.
We're saying it's
I,
preventable.
was heartbroken this week when one of the patients that I was following, who has a wife and young children at home, and I knew he wasn't going to make it, and he didn't, and now those children don't have a father anymore.
Yeah. Ellen, we have a couple
It's
of minutes left. Did you have a question?
Yeah. So Dr. Simpson, my sister is a registered nurse at the surgical ICU at Johns Hopkins. So a lot of the stuff that you're telling me is resonating with the conversations that I have when she gets off work, and she is just so, I mean, like you were saying, like what Liz asked, you guys are like, this is an exhausting time for you guys, especially because healthcare workers have this empathy to feel for their patients. My sister is a brilliant, empathetic woman, and she goes into work and she has to tell tell the children of parents that their parent has died when it could have been prevented because of the vaccine. So, this isn't the first time we've had preventable illnesses. We've had, people die of lung cancer all the time. People have diabetes or other problems due to personal choices. But does this feel extra discouraging that we have so much information about these vaccines and people aren't taking them? I mean, so many deaths could be prevented right now. I guess my question is kind of similar to Liz's, where how my sister's been a nurse for a couple of years. This is all she knows is COVID. But as someone who's been in this field for a long time, how does this feel different from other preventable deaths that people have had? You know?
over the past 2 years, I've never watched so many people die. My specialty has always been dealing with older adults and in long-term care settings. And I am used to people getting sick and dying. And
Hmm.
let's face it, every single one of us will take our last breath someday.
Mm-hmm.
Every
Hmm.
single one of us will. It's
Hmm.
going to happen.
Yep.
And I am used to seeing having some maybe one or two deaths a month, but having so many deaths so quickly, and that's all that we're dealing with. It's exhausting. And right
Yeah,
now,
I can imagine.
21 states and Washington D.C. are the hospitals are 80% full.
Yep. Yep.
Hopkins is
Nurses,
100% full.
yeah, nurses and
No
doctors
beds.
are dealing with higher caseloads than they normally deal with. They're working longer hours. They're picking up extra shifts.
I can't get
Um, you
appointments with my
know,
personal doctors for just
yeah,
Yeah.
issues that I'm dealing with.
Yeah.
And I
Yeah.
think last week, 5 million people in the United States called out sick. Now, we don't not that wasn't all from COVID, but that's an impressive number. That impacts every aspect of our society. That impacts your ability to go to the pharmacy and pick up your medications and pick up your mother and grandmother's medications because they might have their pharmacy techs are out or a pharmacist is out because they've been exposed or they've contracted COVID.
Okay. Unfortunately, we're out of time. I did want to get a couple of comments in from online. Jacqueline Robinson, I would encourage everyone uh, of a certain age to have advanced medical directive, and please let the person appointed to make those decisions for you know where those documents can be located. And I would say that
Absolutely.
we should do it at any age, actually. I would recommend
I
that at
agree.
any age. Jeanette Brown says, what do you think the impact of witnessing mass casualties is on so many people? And then the exhaustion of work shortages mean you can't give the people witnessing this the critical trauma recovery support that they need. And then George Fournier says, it's human nature to put off preparing such vital documents. As a lawyer, I have attended at hospitals to take instructions for powers of attorneys or wills far too many times for people on their deathbeds. So, Dr. Simpson, thank you so much for joining us and telling your stories. Are there any final words that you have for everyone out there?
I hope that if I have convinced at least one person who was on the fence about getting the vaccine to hop off the fence and go out and get one, please go out and get one. Please. This is not the misinformation out there is ridiculous. This is a life-saving vaccine. The risk is very, very, very minuscule. Millions and millions of people have received it. Please, if you love yourself enough to get the vaccine.
Okay. Thank you
That's
again,
amazing.
Dr. Simpson. We wish you, Liam, and Lisa the best. Thank you so much for joining us.